All right, good morning, everyone. It is right on the hour, 8 o'clock, so we are going to get started with the promise that we will end right. I know you all have many, many things to be doing this wonderful Tuesday. My name is Rebecca Bally. I'm a Facilitation and Improvement Specialist with Oregon Healthcare Quality Corporation, or QCOR, and I work with the Patient Centered Primary Care Institute. And today's webinar is Referral Coordination, Primary Care, and Community-Based Resources. So thank you for joining us. Welcome. A quick heads up about some of the interactive pieces. We do want to hear questions from you. I know many of you submitted questions during registration, but we welcome questions throughout the presentation. Here's a quick image of where you can enter your questions in the question pane on the right side of your screen. We don't feel like you have to wait till the end of the presentation to submit, so at any point when you have a question. And then just a little background and introduction on the Institute. The Patient Centered Primary Care Institute is a public-private partnership that was launched in 2012 with the support of the Oregon Health Authority and Northwest Health Foundation. It's managed by QCOR. Together with the experts we partner with, our goal is to get primary care practices connected to a broad array of technical assistance as they work towards the patient-centered primary care home or medical home model of care. We work to serve practices at all stages of transformation and to build capacity and create alignment to support ongoing transformation and quality improvement in Oregon. We encourage you to visit our website at www.pcpci.org to access resources, including this and previous webinars. You can sign up for our email list on the website, which is how we will announce additional web-based and other training opportunities or Institute programs in the future. As I mentioned, the Institute aims to help primary care practices achieve recognition as a primary care home through the State of Oregon's Patient Centered Primary Care Home, or PCPCH program. And the model is a set of standards organized under these 6 core attributes. You can visit the PCPCH program website at primarycarehome.oregon.gov to learn more. But without further ado, I would like to introduce our fantastic presenters today. We have David Ross and Katie Unger from the Oregon Pediatric Improvement Partnership. Mr. Ross is the Improvement and Facilitation Program Manager for OPIP. He has over 9 years of experience with practice transformation and system improvement in primary care. Mr. Ross is the lead research associate on current OPIP projects focused on medical home, screening and referral to community-based services, care coordination for children with special health care needs, and adolescent health. Ms. Unger is the senior OPIP practice facilitator who provides the at-the-elbow support to practices on practice transformation and systems level improvement. Ms. Unger has a Master of Public Health, Health Management, and Policy degree and has over the past 5 years worked with over 20 practices on a variety of topics, including developmental screening, medical home, patient engagement, adolescent health, and care coordination. So as you can tell, they are great experts to have with us today, and with that, I would like to turn things over to them.
Great, thank you, Rebecca. So this is Dave, obviously. Just want to go over the learning objectives for the day first. And that's really to understand some key concepts and considerations related to 1, collecting and managing community-based resource lists, 2, considerations related to effective referrals and how you can work toward effective referrals, 3, considerations and concepts related to referral tracking and tracking referrals that are made, and lastly, things you can do and things you should think about in terms of encouraging effective communication and coordination after the referral is made. So a couple of quick qualifiers and pieces of context. 1, I know there's a wide range of attendees on the call in terms of the settings that you work in. We are obviously an organization that has a focus on pediatric healthcare settings. And we engage other settings, of course, in terms of education and other community-based providers. That being said, a lot of what we say will have a pediatric focus. I think a lot of the concepts are generalizable, but I do want to put that out there, that a lot of the examples and things we'll talk about do have a pediatric focus. And secondly, and this goes along with that, these points in the information in these slides are really meant to provide you context and generalizable concepts that you can use. This particular topic is one that really does depend on the context of your practice, the community that you operate in, and all kinds of things that really are tailored to your specific site and what you do and how you do it. So we've kind of structured this presentation to consider that, knowing that, you know, it's not a recipe. There's not like, even though we'll talk about 4 different steps, for instance, for creating a resource list, that doesn't necessarily mean that you know it's going to be the same for everybody. In fact, we know it's going to be different. So I just wanted to put that out there first. So first I want to set the stage a little bit about why this topic and why it's important. You know, Rebecca went over the slide previously that had the PC-PCH model of care and the different elements of that in terms of access to care, accountability, comprehensive whole person care, continuity, coordination, integration, and person and family-centered care. And especially the parts about accountability and taking responsibility as a practice to make sure that you're taking care of that patient's needs and make sure they're getting the best possible health care. And then the element around coordination and integration really relate to helping families navigate the system. And so a medical home strives to be a hub for all care that the patients receive, which is a fundamental distinction between patient-centered primary care home and a more historical kind of typical primary care provider where you're kind of the first line, you're triaging things and making referrals for sure, but maybe not so much a commitment to this hub, to be really the coordinator, the overall central healthcare provider for a patient. So a medical home sees it as one of their roles to manage their patient population and understand the full set of services that they are receiving and helping facilitate all of that within the community that the patient lives and the needs that the patient has. And so there's a lot of considerations for that. A lot of what we'll talk about today for practices is kind of how to interact with community-based resources. But we wanted to make sure that we pointed out that, you know, it's important that some of these concepts exist within the medical home as well. There are a lot of internal resources that in a lot of practices require coordination, and it's not necessarily referral and tracking internally, but in a way these concepts need to be kind of honed in on internally as well as externally. So in especially larger sites, given the new model, you'll have primary care, you'll have nurses, you'll have some medical assistants, you may have behaviorists, you may have dietitians and social workers. You're definitely going to have the billing and insurance folks, you're going to have administration, you're going to have front desk staff, and potentially, you know, lab techs and whatnot. And making sure that you're understanding communication nodes within the practice is really important. And probably important to hammer out before you start thinking external, because as you can see in this example, the different providers in the community that a medical home may be coordinating with or communicating with is really far-reaching in terms of its scope. You know, so this kind of is illustrating in a real example from one of the practices we worked with. You know, a typical for a specific child's family, a typical kind of map of the different entities that the care coordinator was working with to care for a specific child. So you can see that's not small. And so it's important that medical homes create a node and understand that effective connection and communication with community-based resources will depend on processes that really identify who is that node within the medical home that's going to be the connection to all these different places, and what are the nodes internally to make sure that communicating between the care coordinator that is reaching out to the community and the providers in the office, et cetera. I do want to point out, in terms of making it relevant for everybody on the call, that again, this is a specific component that's called out in the PC-PCH standards, specifically standard 5E, referral and specialty care coordination. The first level does talk about tracking referrals to specialty providers. And then the higher tiers talk about coordination of care and tracking referrals to community service providers outside the PCPCH. So this is directly relevant to the standards. And kind of talking about nationally, referral tracking is part of other programs and tools that are important. In particular, NCQA PCMH also has measures and concepts related to referral tracking and coordination. And the Center for Medical Home Improvements Medical Home Index tool, which is widely used to measure essentially the medical homeness of clinics for children with special healthcare needs, they have a specific component in their tool that references referral tracking and referral care coordination. So there's a concept that's important locally, it's important nationally, and so a lot of people are working on it. So with that background, I'm going to pass to my colleague Katie, who's going to talk about, in more detail, developing and maintaining a list of community resources.
Great, thanks, Dave. So as Dave had mentioned earlier, one of the functions of a medical home is to coordinate care or to become that hub for your patient panel. But in order to coordinate that care, it's essential that you understand the other types of resources that are available in your community. So the goal of this section is to help you guys understand how to document and think through how you could maintain a community resource list within your practice. So in order to create an inventory of community resources in your area, you have to, well, you want to be able to know that those are resources that you would send families to and that your practice is comfortable referring families to or patients to. And that can seem quite overwhelming. So we'll think through how you can do that in a practice setting. So some considerations before you start that endeavor of creating a community-based resource list is thinking about how you're actually going to use this information. Two important questions to think through is who is the primary audience for this list? When you're documenting community resources, is it the provider that is going to be going through the resource list, or is it going to be a care coordinator? And then how are you going to organize this resource list? What we've seen in working with practices is that depending on who is going to use the list, the documentation may differ. If it's one person using the list, they may understand their categorization, but if it is a multitude of people, there are some considerations for documentation, such as, you know, are you going to put an organization under two different topic areas to allow the providers or people using the list to find it more quickly, but then